Let's see. So today, the main target goal for this week is about cancer, which usually it was originally at the end of the class, but I decided to put it in the middle, the start of the second part of our lectures, because this really gives us a good example of how biomedical engineers can play a big role. And still, the top killer in advanced countries are cancer. So I think this is very important for many of us. And so with that, why don't we discuss about biomedical engineering strategies for cancer? So what are we going to cover here? So first, we all know how important the cancer in modern society, and especially even while we are talking about engineering, without knowing the biology and the mechanism, it's not that meaningful. We have to, whenever possible, we have to delve into the mechanism and the biology. This will allow us to have a better understanding and better idea how to treat. So the biology of cancer and the progression of tumors in the cancer patients is very, very important. And so, yeah, talk to your colleague. There are a number of MD students there. Make friends with them so that you can resolve many questions. And I have to say, I'm not an MD, so I don't treat patients. While I have studied cancer for multiple years, so I'm very familiar with this topic. But sometimes real questions, that can be only answered by physicians who deals with the patient, and those are very precious comments. And that's why you guys are studying this. And the jargons and terminologies are important so that you can actually communicate with physicians. So especially first, whenever there comes a cancer, the first thing is the role of surgery. So in diagnosis and treatment of tumor. And also, I just discussed about systemic chemotherapy, and we need to understand the value and limit of the chemotherapy or anti-cancer treatment. The first thing that come up into your mind is chemotherapy and treating cancer. And also, this course is not about only reviewing the past, but we are the one who are developing new methodologies and new approaches to this intractable disease of cancer. So understanding what are the new approaches based on our deep level of molecular and cellular and tissue level understanding of cancer for better treatment, especially nowadays, biological treatments. So these are a list of topics we'll cover this week. Of course, we have to define cancer. Okay, so what is cancer? And this is from now on, whenever you talk to your parents, your friends, you will become a cancer expert, okay? At least you have to be able to say, what's cancer? So cancer is a class of disease, okay? So there are three main features I categorize. So the first is uncontrolled growth, okay, here. Okay, uncontrolled growth, meaning that our body cells are all in check and balance, okay? However, if something goes wrong, if the cells try to proliferate excessively, they will make a mess, and that we call tumor, okay? So tumor is a must in cancer, okay? And then, but, just a big, you can have some molds in your hand and foot, and that we don't call cancer because they have somewhat level of uncontrolled growth, but they are safe because they don't invade nearby tissue. So the second of requirement when you call cancer is invasion into the neighboring tissue, and that can destroy adjacent tissue. But why this is important is do you remember majority of the solid tumor is arising from epithelial tissue? And remember, go back, epithelial tissue or epithelial cells always sit on top of basement membrane. And you remember there's no blood vessels whatsoever inside the epithelial tissue, okay? So it's safe, even if it becomes like bigger, making a tumor, so it's still okay until these cells become crazy enough. These epithelial cells are usually programmed that when it becomes detached from their bottom, and they're programmed to die, but they go right that strangely they don't die and they even protrude their basement membrane. So they actually dissolve and tear and then get into that we call invasion and microsphere, okay? So that invasion is a second requirement when we call cancer. And what that means is when they protrude, invade beneath the basement membrane, there exist blood vessels and lymphatic vessels and other organs. Okay, so that becomes a problem because there is a potential that these invasive cells now can crawl down to reach blood vessel or lymphatic vessel, which they can be now utilizing our transport system to transport to another place of the body. So we call distant part of the body. And if they are aggressive enough, they can survive there. They can form a tumor again. We call it colony. And this new formation of a colony in the secondary part, and that process we call metastasize. So metastasis, or spreading to other location in the body via blood or lymphatic vessel. So that's three. So when we call when do we call cancer? First, tumor formation, uncontrolled growth. There are some liquid cancer which do not have tumors. So uncontrolled growth and invasion into the neighboring tissue, metastasize. And this actually means a gloomy outcome, and that we call cancer. And cancer is a class of disease. So then let's look at the tumor first, because that's the first thing when we identify in the clinic. And two types of tumors exist. And you guys have to understand the concept of, let's say, oh, my mom has an ovary tumor, then we have to concern that. Oh, did you go to hospital? What did the doctor say? And they say, that's benign, it's big, so you have to do surgery to take it out. In fact, many females at certain age have these issues, so it's not uncommon. And however, when we talk about this, we always talk about, was it like dangerous or not dangerous? The not dangerous we call a benign tumor. In comparison with a dangerous one, we call malignant tumor. So how do we define, I feel safe or I feel dangerous? So there are clear characteristics of this benign versus malignant tumor. So first, benign tumor means the tumor, the cellular growth, proliferation is self-limited. So it's kind of confined, okay? So it's expansile rather than infiltrative. Remember, invasion is a very important part of defining cancer. So no invasion, okay? So no invasion means they will not be able to move to another part, which is metastasis. So no metastasis. Because metastasis is a key for the cancer, danger or death, right? While what about the bad news, which we call, hey, sorry, your mom's tumor is malignant. What does that mean? It means the doctors will find out the tumor is not only growing, but it infiltrates to nearby tissue, and so that there is a potential for metastasis. However, it's extremely difficult to find metastasis at its happening and its sites. But what if you find someone has a primary tumor and find out somewhere in the bone there's a pain, and you realize there's a tumor growth? That it's very likely to metastatic tumor. That's very likely to kill the patient. Okay, so cancer is a generic term which we call cancer, but it's more in a professional way. It's called malignant neoplasm. And so neoplasm is a new formation, okay? So it's in Greek. So hopefully, I think I wrote some of these for your understanding, because these are all kind of jargons. And metastasis meaning rapid transition from one point to another or to change. Okay, so now I will use more of neoplasm here. So when we call benign versus malignant, and why benign tumors are benign? Because their growth is rather slow. So it's you still have time. It doesn't make a rapid change. But malignant tumors are rapidly growing. Okay, you will be surprised that, like, the tumor can grow very, very fast. Okay, so you hear from time to time, like, if someone got diagnosed with cancer and died within several months, this happens. Especially tumors growing like, this can grow like crazy. It can be exponentially growing. And what's important is the encapsulation of the tumor mass. So whether it's a self-limited or infiltrative depends on this encapsulation. So where differentiated capsule exists in benign, while it's not encapsulated, that's becoming malignant. Okay. So that gives us whether invasion happens or not. It's very important. Especially malignant tumors are invasive to local structures and tissues. So this is really telling the patient whether you have to be concerned or not. And of course, it's a growth is slow versus rapid means the cellular division or proliferation, how fast it is. So we define a way of this mitosis or cellular division or proliferation. So the cell division have a rare in benign versus many dividing cells. What that means is, so mitotic cells, the cells which seem to have like 2 nuclei, or you remember from the cell cycle of this mitosis, out of, let's say, 100 cells, half of the cells are dividing, then mitotic index would be 50%. So if there's really high mitotic index, that's likely to be malignant. And of course, metastasis is the key, or distant spread. And benign is why benign? It doesn't metastasize, so surgery can easily remove the tumor and the patient will be safe. While malignant tumors, the big issue is all these one is pointing towards the tumor can metastasize through blood vessels or lymphatic vessels. So here's a kind of a schematic, which is well showing. So I want to share with you. So normal cells, and in fact, tumor cells are not that different color. I have to say, this is only for your understanding. But you see, this encapsulation can be rupture or and tumor cells come out, and these are like malignant cells can invade neighboring tissue, enter blood vessel, and it can metastasize to different tissues. So I want to give you some of the malignancy example in dermatology, which there's a simple rule people like dermatologists use, so-called ABCDE. So this is a simple rule. If you have a like people around you, you can check if you have this skin lesion, whether it can be dangerous or not, or concerning or not. So look at that, this left and right, this is like kind of symmetric, and this is asymmetric. So we call this asymmetry is kind of like towards more malignancy. And the other is, let's look at the border of this lesion. And you see this is rather clear, but this one you see a little dimmer and dimmer, so irregular. And so that shape of the border matters, whether it's regular and geometrically confined or irregular. And the other is a look at the color. So this one shows much light to dark heterogeneous color, while this is rather single. So the color matters. And what about the size? Of course, size matters. If So in skin cancer decision, like 6 millimeters smaller and larger, it's more likely to be malignant. So it's a diameter. And lastly, you have, if there's a reason, you go to see doctor, and after a while you go to there again, or you look at your reason. So I have made a small of this like dots. You want to see it over time to see if it actually grows or not. So that's evolution. Okay. So if it's still there, you don't have to worry, but you find it's markedly increasing or changing shape, you may have to consider. So this a simple like morphological way is giving some way, I'm saying it easy, but it's not easy to really say malignant or not. But all of these one, if you met more number of this, this lesion can become more malignant. Okay, so now then consider about what about this cancer statistics? We call this epidemiology. Okay, epidemiology is a prevalence of disease. So let's consider about this neoplasia and thinking about the first. Cancer is a disease top killer in developed country rather than developing country. The reason is the cancer death or cancer incidence is growing when people get older and older. So if developed country, many people are living long enough, then they live long enough to get cancer. But if developing country, maybe their life expectancy is not that long, then they may have other reasons of the cause of that. Okay, so why elderly people are getting more cancer? Let me ask a question to, let's say, Sang Kyu-ho. I cannot see your face though. Please show me your face. Sang Kyu-ho?
Yes.
Okay, yeah.
I have some problem in my notebook, so I.
Okay, that's fine. Yeah.
I join with my desktop computer. So
I see. Can you answer why elderly people are getting more cancer than young people?
Actually, I think because the aging and some environmental factors affect the generation of cancer.
Okay. Yeah, I think that's important to mention environmental effect of how aging self will give rise to cancer.
Because when aging happens, then our cell have some problem in repairing DNA DNA repair. So maybe that's why we are more susceptible to cancer.
Okay, I think that Kyu-ho's answer contains many important. So, once you understand this, cancer comes from mutation, accumulating mutation in the DNA, and that mutation is proportional to how long you actually have lived. Okay. Also, Kyu-ho mentioned the importance of environmental factor, which we will get back to soon. Okay. Okay, so that makes sense, and even gender. Yeah, gender matters because male, female have sometimes different organs. For example, ovarian cancer can only happen to female, and prostate cancer happens only on the male. So it can be gender specific. And breast cancer usually happens to female, although it's not impossible for a male to get breast cancer. Okay, and geographic aspects. Like you guys remember that in Australia, and many people are prone to get skin cancer, and that's the ozone layer has a hole and there's more UV exposure in that continent. And so people tend to have more skin cancers. So that geography matters. And also like geography and latitude changes the amount of the sunlight, and that gives even our skin color has evolved to change depending on that. So more Caucasian people are more prone to skin cancer, while dark skin color, which has a melanin pigment, which blocks the sunlight, so that we have dark colored people has a less of a skin cancer arising. Okay. And then occupation also matters. So there, in the past, when we didn't understand about tumor and cancer, there's a rumor that in England, a chimney boy in the early days. So chimney boys are like working through cleaning the chimney, and they tend to get lung cancer. So people didn't know why, but these people or miners, they got exposure, more of the exposure of little particles, which they inhale, getting into their lungs, and they get the exposure. So occupation matters. For example, I give you one cartoon over here. So even in South Korea, when we were growing in 1960s, 70s, so all the house, originally it was made out of plant, okay? But now they changed it into slate, which I don't have it here, so slate. But unfortunately, at that time, we didn't know slate is composed of asbestos. So here is a fine tip, asbestos fibers. And that fiber turns out that it actually causes a lung cancer. We didn't know it before. So now we are like removing this asbestos and these ones from our construction. Then why did it become a problem? Because these little fibers, little fibers can get into our lungs, okay? It's little, but for cells, it's not that little. Inside our lung, we have lots of macrophages and immune cells. And when they got to see this, they see this foreign material trying to engulf them, but it can't because it's so big. So the cells getting enveloped, these fibers, and that causes a genetic mutation of these cells. And it causes a special type of cancer called mesothelioma. So that environment actually affects the cancer incidence. Okay, of course, heredity matters, because in the end, cancer is a disease of genetics. However, what I want to focus on here is heredity is not the sole causes of cancer. That's kind of what I want to tell you over here. But let's see how heredity makes the cancer with this inherited mutation. Well, look at that, tumor type, ovarian cancer, about 20% are from heredity, stomach cancer, breast cancer, so many. But if you look at the percentage, hereditary cancer is not that high. So what about the rest is a question, okay? And I will discuss about this later on. So let's now move on to the hallmarks of cancer. So now, the field of cancer is mature, although it's still popular, that we know a lot about this before, like, several decades ago, 2 decades ago, a decade ago, even now, we have accumulated a lot of knowledge. So I want to go over all this, and which we call as the hallmarks of cancer. And what is hallmark? Hallmark is this one's hallmark. Step, okay? So like, there's a history that Doug Hanahan at UCSF and Bob Weinberg at MIT, they wrote a review paper in 2007. And that review paper, if you look at Google Scholar, their citation is over 50,000. And this is so influential that they name it as a hallmark, okay? Actually, I learned from Bob Weinberg from my cancer biology. So this hallmarks of cancer is like kind of the several of features of cancer. And this, once you understand it clearly, I think it'll give you a great background for understanding this. So this first one I'm discussing about 2 decades ago. So I'm not discussing recent ones. So the hallmarks of the cancer. And then 10 years after, they actually wrote another one, the next generation, because for that 2000 to 2010, a lot of more understanding has come because of big fundings and a lot of research efforts, and that I'll cover it later. So what's the first one? And you remember that proliferation. So acquisition of self-sufficiency, growth signal. So how the cells grow? Because there's growth signaling happens, so cells divide. So it's sustained. So that makes the cancer feature top, number one. And the second one is the loss of sensitivity to anti-growth signal. Remember, our tissue or cells in our body are always check and balance. But if there's a movement towards like growth, then there's also mechanism to suppress the growth, okay? But this anti-growth signal is being lost in cancer, and that gives you cancer or tumor growth. So evading growth suppressor, because our tissue has a growth suppressor mechanism, and that's unchecked. All right. And the third is we discussed, and even I think I gave you in midterm exam, that about the cell death. So you remember when the cells divide a certain finite time, there will be shortening of the telomere, and then the cells will undergo death. However, cancer cells, maybe many times, they are resisting this cancer death. So loss of apoptosis to allow growth despite genetic errors. So, somehow over 90% of solid tumors have overexpressed telomerase enzyme, which what it does is it adds a telomere to the dividing cancer cells so that they don't die, they don't undergo apoptosis even multiple times of proliferation. And then, and the fourth kind is about senescence. Okay, so you remember that when we discussed about cell culture, when the cells divide and divide, this was a little fast, so you may not remember. But towards the end, the cells somehow enter into senescent state, which means the cells really do not divide, don't do much. So it's like human senescence, okay? But losing that capacity to enter into senescence, and then the cells live forever and limitless replication, keep dividing, and they don't become senescence. So that is also a characteristic of tumor and cancer, enabling replicative immortality. Okay, so far, that is about the cells. But what about the cancer to sustain their volume and their expansion? Now, they will reach to the diffusion limit of transport of oxygen and the nutrients. So they secrete factors to bring new blood vessel forms towards them. And that we call angiogenesis, literally means angio blood, genesis, new formation, new blood vessel formation, right? So they actually induce angiogenesis, and that's a hallmark of a cancer, allowing tumor to grow beyond the limit of diffusive, passive nutrient diffusion. So, like, in literature, people say over 1 cubic millimeter, when the tumor becomes higher, they do require angiogenesis. So a great idea for that discovery is, hey, maybe instead of targeting the tumor cells directly, we may target not tumor, but the supply of the tumor, which is vessel formation. So finding out the molecular mechanism and then targeting those actually give a great, another tool for the war against cancer, which is called anti-angiogenic therapy. So that's why their molecular mechanism and the engineering is so important. And when we come up with an idea of better treatment. Okay, so lastly, I want to discuss about, this is probably the hallmark, the most important when it becomes a cancer, okay? So that's the ability to invade neighboring tissue, okay? And ability to build metastasis, which means they will go to distant sites and form a new colony, and which is a hallmark of cancer. When I say, I said three simple ones: uncontrolled growth, invasion, and metastasis. But if you look at inside, these are six key features are very important when we talk about cancer. And again, here carcinoma, well, I said carcinoma is a tumor arising from epithelial origin. So now, I have discussed this one 20 years ago, okay? But what about afterwards? You know, we understand much more than that. So now we are entering into talking a little bit further our understanding. So that's our understanding of cancer has been evolved. In the past, many people just culture in vitro cell culture of tumor cells and figuring out a signaling pathway and developing an inhibitors of this signaling survival pathway, proliferation pathway, and so that we may be able to stop their growth and kill the tumor cell growth. So that's good. But however, the patients still die. And why? Because of our viewpoint of cancer and our study of cancer, the method has a limitation. So from the reductionist point of view, we consider cancer as just a pack of cancer cells. This may be true in some cases of specific cancers, but in the end, what the reality is, cancer is not, the tumor is not only composed of cancer cells. That is the problem. So what's a more realistic view, more evolved view is heterotypic cell biology point of view. In fact, this inside the tumor, we have to see what are the players. So of course, there are like extremely explosively growing number of cancer cells, but they are not alone. They actively interact with our own other cells, so-called host stromal cells. Okay, so which includes over here, the cancer cells are together with fibroblast, which is fiber-producing cells, such as collagen, okay? Fibroblast cells, and also there are immune cells. You know, immune cells are everywhere, okay? And also there are feeding blood vessels, which means blood endothelial cell. So now our viewpoint of tumor is not just a simple, simple mass of cancer cells, but actually it's a complex tissue. So some people claim, some oncologists call this cancer, a tumor, as an organ. I mean, this is not our physiological organ, but you know, the reason why this form as a tumor mass and that malignant tumor is kind of an organ, the reason is the definition of organ is composed of multiple types of tissue or cell type. And this is like that. And this is the drawing I made from my book chapter. So you look at that, the tumor composes of not only cancer cells, but stroma cells and blood vessel, and also extracellular matrix. Here I mentioned stroma cells. And what do I mean by stroma? Stroma means a supporting, okay, connective tissue, cells of an organ. So it can compose of fibroblasts, immune cells, and vasculature cells, etc. So we call stromal cells, and when we talk about tumor as an organ, so you have to understand this terminology, which is very important. Many times medical people say parenchyma. Parenchyma versus stroma. So in an organ, the business end, those we call parenchyma. So for example, liver, So liver parenchyma means hepatocytes, but there are other types of cells. Those we call stromal cells. Likewise, in tumor, the main cause of tumor is cancer cells. So cancer cells are parenchyma, and tumor stroma is these other types except the cancer cell. So malignant tumor as an organ, that parenchyma is a tumor cell and host stroma cell. Okay. So our understanding is now a little more complicated. So such that we now understand to really target and fight with the cancer, we just not only consider the cancer cells, we have to understand their environment, we call microenvironment. So this is 10 years after the Cell paper. Now, I think this one has even more a citation now, that the next generation, how our understanding of cancer has been evolved. So there comes a much more players are identified so that we have more, more of a deeper understanding. So look at that. So not only this cancer cell, now we have a concept of cancer stem cell. In fact, many people doesn't consider it's a real stem cell. So sometimes in literature, you will find cancer stem dash like cell. Because stem cell is actually quite difficult to define. We define still like a number of cell surface markers, okay? CD blah blah, positive CD blah blah, negative CD blah blah, and then we define it, breast cancer stem cell, okay? So it's still controversial. However, the big idea is even if we give radiation or chemotherapy to reduce the tumor mass into like little tiny, however, you remember stem cells. Stem cells are like limitless replication potential. So they have they're very strong cells. So they tend to survive, and they are the one who may be the cause of a rapid recurrence of the tumor. So the idea is, hey, instead of just killing all the tumor cells, maybe it's better to target these stem cells. So that's why stem cell or cancer stem cell become more important, attractive target. So that you have to understand the characteristics of this and mechanisms of this. So that's cancer stem cell, and also immune inflammatory cells. So, in our body, normally, our immune cells role is surveillance. Look at if there's a strange behaving cells and get to them and kill them. But this tumor mass, more and more study actually leads towards that the tumors, likewise, they are very smart in that aspect. They convert their microenvironment to make the immune cells like not the enemy, but they are like common friend. So this is a kind of very interesting phenomena that even, let's say, macrophage, there's M1 type and 2 type, they realize tumor cells can convert immune cells, becoming friends and even promoting the tumor growth. So that's some of the finding, and we better understand to come up with a better idea how to treat this problem. And also endothelial cells and now parasites is a supporting cell in the blood vessel. And so the role of this one, and also interestingly, so-called CAF cells or cancer-associated fibroblasts. You remember 2 decades ago, we talked about stroma cells composed of fibroblasts. But now people look at this fibroblast versus other fibroblasts, they found something different. So that there's some role of this, and they named it as a cancer-associated fibroblast. You know how they study? They actually bring this fibroblast and then bring the media, so-called CAF media. And if you use this media, tumor grows faster. Right, so you want to try to find out the factors which promote tumor, especially coming out from these CAF cells. So these are some of the newer understanding. And then, the more we study, we realize there's a more complicated method for cancer cells to thrive in our body, so that their goal is, growth and even later killing of the patients. So look at this core primary tumor. So now the concept of microenvironment is very important. This is why many times in vivo study is become very important. Okay, because in vitro, you cannot mimic the blood vessel and some of this microenvironment. So the metastatic cells, which is invasion, so they invade and they reach to another microenvironment. If they get into blood or lymphatic vessels, they will go flow and then reach to other part of the body. So you see different color. This is cell paper, by the way. They use this artistic background. You see different color means different microenvironment. You know, many cells faced with different environment, they die, okay? It's like human too. When we face a new difficult environment, we may not live long, but metastatic tumor are those who can thrive into different sites. So that means they are very difficult to treat. Even with the same chemotherapy, metastasized cells or metastatic tumors are more difficult to treat. Okay. So as I said before, both parenchyma and stroma of tumors contain distinct cell types and subtypes that collectively enable tumor growth and progression. And especially interesting, immune inflammatory cells present in tumor can include both tumor killing, you know, that's their original role, as well as tumor promoting subclass. So this is kind of a new finding, okay? Hopefully I give you, this one, you can read these 2 cell review papers called Hallmarks of Cancer. You Google it, you will find, you know, tens of thousands of people have already cited, which means, or whenever you say cancer, you have to know, but I have to make sure this is like doctrine. Don't trust anything. I mean, this is people have gained insight, but that doesn't mean that, you know, we know everything about cancer. So don't limit your idea and your criticism. Just don't believe this one like a religion, okay? All right, so let's move on. Now a little bit general aspects of cause of cancer and cancer metastasis. So first, the cause of cancer is, of course, cancer is a disease of genetics, okay? And then, so we talk about genes, and I will discuss about 2 categories of the genes which is causing cancer. So it's like when you're running I don't know you drive or not. So I have a car. So normally it's okay. It's a good balance and check. But when sometimes the car just keep going and I can't stop, and that's a problem, we can have an analogy with the cancer. So first, if I push accelerator, the car will accelerate, okay? So that we call an oncogene. So cell proliferation, we are always keep check and balance, but like accelerator pushing, and that drives the cells to keep proliferating. And those genes we call a proto-oncogene, and if it's normal state, but when there's a mutation, this proto-oncogene become an oncogene, which means onco, tumor causing gene, okay? And another aspect, so like while driving, I realized my brake is broken. So if I can't stop the car keep going. It's like in cancer, you have to stop, check and balance. You know, our normal cells have this suppressor aspect of tumor formation or proliferation. So we have the brake system, but if brake is broken, then the car keep going or the cell keep dividing. So that's another aspect of cancer gene we call tumor suppressor gene. Okay, so these 2 are something I want to have 2 gene classes responsible for triggering cancer. So normal genes regulate cell growth. Let's say we have gene 2 or layers in 2 chromosomes, homologous chromosomes. And if one mutation happens and that gives a growth signal, then the car keep going. Okay, so that this gene we call proto-oncogene. It's not directly causing cancer. It's a normal gene, okay? However, if there's a mutation that keeps this gene turned on, and that we call oncogene, that mutated proto-oncogene. And then because the car keeps going, cell keeps dividing, and that leads to cancer. So that's an oncogene. It promotes cell growth. Mutation of this proto-oncogene creates an oncogene, and that causes cancer. Okay, and so one important aspect is even one mutation actually leads to cancer, but it's a little different story when it comes to a brake system of our cell, which is tumor suppressor gene. So let me show you here. Normal genes regulate cell growth, and they're suppressing tumor formation, okay? But there's two genes, two layers, okay? If there's a mutation in one of these genes, so brake system, you can consider it has two brakes. So one brake is broken, still another brake is there. So first mutation is so-called carrier. Still the car has a brake system, that's fine. But what if over time, as Jang Hyo said, aging matters because over time mutations accumulate. And then even second mutation happen, then there's no brake left and the car keeps going, cancer is being formed. Okay, so that part we call tumor suppressor gene, and what the role of this gene is inhibit cell division. Okay, so what if I have a chromosome which I inherited, a loss of chromosome of this tumor suppressor gene, and as I get older, I happen to have a mutation in my tumor suppressor gene. Even one hit can cause me a mutation. This we call susceptible to this tumor. And this has a hereditary reason. Okay, so that's why, I'm sure in the pretty near future, we now can actually sequence our DNA. If we find out we have, let's say, one mutation in this tumor suppressor gene, we are more susceptible to this type of cancer. So we have to be careful for that and understand. So there are, like, for example, colon cancer has this mutation, okay? So this we call two-hit hypothesis. In this case, one mutation is not enough, but you have to have a double mutation. That's why it takes years or sometimes decades to accumulate to become real cancer. However, it does because we live long enough, all right? So that hopefully these two, oncogene and tumor suppressor genes, are two gene classes responsible for initiating cancer. Now, I explained to you before the cause of cancer or the formation of cancer, we call it carcinogenesis. And you know that what gives a mutation, so you want to avoid this. For example, chemical carcinogens such as to burn food, or radiation such as strong UV light that could cause a skin cancer, and even virus, viral infection can actually cause a cancer. Okay, so these are carcinogens which we, from environment or our behavior, we could avoid or minimize. So the important thing is, what is cancer? What causes cancer? Within our cells, oncogenes and tumor suppressor genes, mutations at that genes can be causing cancer. They are the primary cause of cancer. Okay. So now when we look at some of these literatures, you can see causes of cancer, especially environmental factors. So for example, diet, obesity is a huge factor. Tobacco, smoking is a factor. And certain type of infections can also cause cancer. For example, like liver, some type of virus can cause a liver cancer, and the radiation. Of course, stress, lack of physical activity, and environmental pollutant, such as I showed you asbestos from this slate, okay, inhalation can become responsible for cancer. So all these are something we can reduce the risk by changing our behavior. So I'm telling you good news. Over 90% are environmental factor. So all you guys, hopefully you guys reduce your cancer risk by controlling your environment, diet, sleep well, don't get stressed, and move, don't smoke much, blah, blah, blah. Okay, but what about the rest, which is only 5 to 10% are actually genetic factors. So in fact, less than 0.3% of our population are carrying genetic mutation, which has a large effect on cancer risk. Remember the tumor suppressor gene? If you already have mutation inherited from your parents, you have a much higher risk of developing that type of cancer, okay? So heredity causes less than 10% of all cancer. There are examples called BRCA. It is a breast cancer related gene, BRCA1/2 mutation. And that's known that if you are carrier of BRCA1 or 2 mutation, you have a higher risk of breast cancer or ovarian cancer. There's a famous story of Angelina Jolie, who actually carries this mutation. She has undergone total mastectomy, which means like both of her breasts are removed. Even she doesn't have a cancer, but she knows that she has this at higher risk, getting cancer and die versus, so she actually I think she was a very good speaker. She wrote in New York Times, so many people got informed, and these genes are very important. Okay, so I'm gonna read a New England Journal of Medicine 2000 about this. Inherited genetic factors make a minor contribution to susceptibility to most type of neoplasm cancer. This finding, what they mean is environment that has principal role in causing sporadic cancer. So, I mean, in fact, we don't want to die from cancer, but, which means environmental control is very, very important. While, in this genome era, you guys can easily do a genetic test, and you can actually find out if you are the one of rare mutations which can be causing cancer, then you can actually do preventive measure as well. Okay, so now I want to discuss about I think this is probably the last part of today's talk. So in the end, people will say, why are you scared about cancer? Why cancer are top killer? What causes cancer killing people? And your answer should be because of the metastasis. Why? Majority of solid tumor patients die from metastasis, not from primary tumor. Let's say breast cancer patients do not die of breast tumor, okay? So what it means is the tumor, most of the tumor, solid tumors are of epithelial origin, as I said. So here, there's a picture, epithelial tissue, the growth and forming a mass is we call primary tumor. This is benign. This is okay. However, when there comes an invasion and angiogenesis, if they are reaching to to bring a blood vessel to them, and that we call when they proliferate big enough to cause angiogenesis, and that become a problem. Why? When you look at it at the microscopic level, what happens? These epithelial strange cells now will detach from where they are and start to crawl out. We call migration or invasion, okay? And invasion to where? Beneath the basement membrane where blood vessels and lymphatic vessels exist. Why it's a problem? Because they will be able to get into this circulation. And you know, this is Isaiah Fiedler, who died last year, a father of cancer metastasis study, and his named it embolism. You know, we call embolism somewhere else. Why? Even tumor cell can embolize, which means origin from traveling clot, now traveling cancer cell. So they are got into circulation. When they get into circulation, where do they go? Heart, where do they go? The first they get into the lungs to oxygenate. But in this case, cancer cells are usually bigger in their cell body. Okay, and that's in general. So they got arrested in the lungs or some other organs. They adhere to the vessel wall, and they sometimes can crawl out of a distant part of the body, and that we call extravasation. Okay, so for example, lung met or lung metastasis can happen. We actually create animal model very easily, lung mets. How? You just inject cancer cell into the tail vein of a mouse. Then that venous transport eventually get into the lungs, and they got stuck into lung. I don't know how physiological it is, but this is a simple, good way of in vivo lung metastasis model. So, but then when they get out, they can get in. So in comparison, how do we call the primary tumor? The cells get into the vessel, we call intravasation instead of extravasation. Actually, I was trying to look at the intravasation process with microscope at the beginning of my postdoctoral study. I failed those, although, because it's very rare, it's hard to find, right? So when they extravasate, they establish a new, they adapt themselves into a new microenvironment, they proliferate, and angiogenesis. In this case, this is lung cancer. It doesn't have to be lung. It can be brain, it can be bone, it can be liver, okay? So the primary tumor is the area cancer cells at the originating site. Remember, in general, primary tumors are not that dangerous unless that site is too vital, such as liver, okay? And the real death, cancer death, over 85% of cancer death comes from metastasis, or this is secondary tumor. And why? Think about the cancer cells. They survive from primary to this metastatic tumor. They're like triathlon athletes. They're strong cells because they have gone through these multiple hurdles. So only those strong, aggressive, very, very resistant cells can survive. So when the cancer cell acquires the ability to penetrate and infiltrate the surrounding normal tissue and spread and grow into a distant site, that already means that they are harder to treat, okay? And they are the main cause of death. And still, I have to say, we still do not know the whole mechanism. So you haven't heard about metastasis preventing drug or curing metastasis. No, it's not possible yet because we do not know enough. So that's what I can say. And so the more research, if you are into cancer research, you have to really think of the importance of the metastasis. And also, I have to say, because I was working in this field before, it's very hard to make animal model, a proper animal model for this. All right, so today is the first day for cancer, and I hope this top killer problem is an example for us biomedical engineers to think about what that targets are, the real clinical problems are, and treatment challenges are, so that we can come up with a better way. So think it's 23. I give you 3 minutes of writing your questions, and next time we will finish up like cancer screening and more engineering aspects of treatment. All right, thank you for your attention.